everyone, my name is Carol Quijada, and I am currently a graduate student at Oklahoma State University Center for Health Sciences. This summer, I had the privilege to do research under Dr. Kristen Olofsson and her research project, Building Resilience in Rural Communities, with my focus being in public health. The first focus of the study was to hear about the challenges citizens face in accessing healthcare and nutritious foods, and what they do to overcome those challenges. The second focus of the study was to gather information about the relationships with healthcare providers. For example, do healthcare providers do a good job of explaining procedures to you? My purpose of the study was to find more information about how citizens viewed their health disparities in their communities. Do people in Tillman County feel like they have any type of health disparity? The methods that we used were 23 semi-structured interviews conducted in Tillman County. We managed to interview a diverse group of citizens with different roles in the community. Now to move on to the findings of the study. People in general feel like the community is vulnerable because of the lack of emergency services. Tillman County does not have after-hour care, meaning if a person needed medical attention after normal office hours or on the weekend, they would have to drive to the nearest town, which would be a 40 to 45-minute drive. There is only one grocery store located in Tillman County, and it is in Frederick, Oklahoma. Citizens say the variety, freshness, and prices of the food is not always the best option, and if you don't live in Frederick, transportation could be an issue. The healthcare providers are seen in a positive manner, but there is only 4 established physician or physician assistant, stretching that resource for over 7,000 people in the county. Mental health and substance abuse resources are very limited, even though citizens believe it poses a significant risk to their community. Here are some quotes I found interesting over the summer. There is a courthouse in every county. Why not a hospital? Long-term male resident. So when my kids or I have to be seen, we have to go to Lawton for our medical care. If you need a surgery or hospital stay, you're going to have to go to Lawton. You know, I know people have issues with travel or their transportation. I know it's not an easy thing. Interviewee in the healthcare field. Our local healthcare providers my experience with them has been wonderful. A female working class resident. These quotes stand out to me because local medical professionals are held at a high regard, but citizens still feel frustration and worry about why their county doesn't have access to a hospital. In conclusion, these findings are important in understanding the challenges people face living day to day in Tillman County, and who's being affected most by these challenges. Establishing some sort of aftercare is vital for the community, especially for the older population. It can make residents feel more comfortable about living there, provide jobs, and lighten the workload for the Tillman County Emergency Medical Services by not having to drive to Altus or Lawton for each patient, which is a 30 to 45-minute drive one way. Access to nutritious foods is a struggle for the working and lower classes due to there only being one grocery store with limited options and higher prices on goods. Further research should be done on the impact money, housing, and transportation have on access to services and goods, and the effect it has on individuals as well as the whole community. Thank you everyone for listening to my presentation, and we will enter a discussion here shortly.